A medical scribe plays an essential role in modern healthcare by assisting physicians in documenting patient encounters efficiently and accurately. They ensure that doctors can focus on patient care instead of paperwork by recording medical histories, physical examinations, diagnoses, and treatment plans in real time. Employers look for candidates who are attentive, fast learners, and comfortable working in a fast-paced clinical environment. In this guide, we'll cover some of the most common medical scribe interview questions, along with effective sample answers and practical tips to help you prepare with confidence. Understanding the role of a medical scribe. The job of a medical scribe goes beyond typing notes. It requires strong listening skills, understanding of medical terminology, and attention to confidentiality. Scribes must document accurately, keep up with the physician's pace, and handle electronic health records, EHR, efficiently. During the interview, hiring managers will test your multitasking abilities, focus, adaptability, and professionalism in dealing with sensitive information. They'll also look for your ability to learn quickly and maintain accuracy under pressure. Question 1. Why do you want to work as a medical scribe? Here's how you can answer. I want to work as a medical scribe because it combines my interest in healthcare with my attention to detail and fast typing skills. It's an opportunity to learn directly from physicians and gain real-world clinical experience while contributing to smoother patient care operations. Tip: emphasize both your interest in medicine and your enthusiasm for learning through hands-on experience. Question 2. What do you understand about the role of a medical scribe? Here's how you can answer. A medical scribe assists doctors by documenting patient visits in real time. This includes recording patient histories, physical exam findings, lab results, and treatment plans. The goal is to ensure accurate, timely documentation so physicians can focus fully on patient care. Tip: show that you clearly understand the position's purpose and value in clinical efficiency. Question 3. How do you ensure accuracy when documenting patient information? Here's how you can answer. I make sure to listen carefully to the physician, confirm unclear points immediately, and review my notes before finalizing entries. Accuracy is crucial, so I maintain focus, double-check spelling of medical terms, and cross-reference with the EHR for consistency. Tip: highlight concentration, thoroughness, and commitment to error-free documentation. Question 4. How do you handle working in a fast-paced environment? Here's how you can answer. I stay organized and calm, even when the pace is intense. I prioritize active listening and note-taking speed, but I also make sure not to compromise accuracy. I've learned that preparation and familiarity with medical terms help me keep up efficiently. Tip: demonstrate composure, time management, and readiness for pressure. Question 5. How familiar are you with medical terminology and EHR systems? Here's how you can answer. I've completed coursework in medical terminology and anatomy, and I'm comfortable using electronic health record systems like Epic and Cerner. Understanding medical vocabulary helps me follow consultations easily and document with precision. Tip: mention specific systems or training to show your readiness for clinical work. Question 6. Can you describe a time you handled confidential information responsibly? Here's how you can answer. In my previous role, I had access to sensitive data and ensured it was protected at all times. I followed privacy policies strictly and never discussed information outside authorized contexts. As a medical scribe, I'll continue to maintain full confidentiality under HIPAA guidelines. Tip: reinforce your sense of responsibility and understanding of patient privacy laws. Question 7. How do you stay focused during long shifts or repetitive tasks? Here's how you can answer. I keep my attention sharp by taking short mental breaks when possible and maintaining good posture and focus techniques. I remind myself that every record I complete contributes directly to quality patient care, which keeps me motivated. Tip: show mental discipline, consistency, and motivation even during long hours. Question 8. What would you do if you didn't understand a physician's instruction? Here's how you can answer. I would politely ask the physician for clarification as soon as possible to avoid recording inaccurate information. I believe clear communication prevents mistakes and shows professionalism. Tip: emphasize that you value accuracy over assumptions and are not afraid to clarify respectfully. Question 9. How do you prioritize your tasks when multiple patients are being seen quickly? Here's how you can answer. I stay organized by tracking patient flow and managing my notes chronologically. I complete each record promptly before moving to the next. I also rely on established templates and shorthand to document efficiently during high-volume periods. Tip: highlight multitasking, organization, and systematic thinking. Question 10. How do you handle stressful situations or high workloads? Here's how you can answer. I stay calm and remind myself to focus on one task at a time. I've learned that being proactive, like preparing templates or anticipating what the doctor needs, helps me manage heavy workloads effectively. Maintaining composure also ensures accuracy. Tip: show emotional stability and practical problem-solving in stressful conditions. Question 11. Why is confidentiality important in healthcare documentation? Here's how you can answer. Confidentiality builds patient trust and complies with legal and ethical standards. Sharing or mishandling information can harm patients and violate HIPAA regulations. As a medical scribe, I understand that protecting patient data is one of my top responsibilities. Tip: demonstrate strong ethics and awareness of privacy laws. Question 12. How do you ensure your notes are both detailed and concise? Here's how you can answer. I focus on including all medically relevant information, symptoms, findings, and treatment decisions, while avoiding unnecessary details. I follow the physician's dictation closely and use standard medical abbreviations to maintain clarity and efficiency. Tip: balance completeness with brevity. Accuracy is key, but clarity matters too. Question 13. How do you handle feedback or correction from physicians? Here's how you can answer. I appreciate feedback as an opportunity to improve. If a physician corrects something, I make the necessary adjustments immediately and note it for future reference. Learning from feedback helps me refine my documentation style. Tip: show humility, professionalism, and eagerness to learn. Question 14. What are your long-term goals in the medical field? Here's how you can answer. My goal is to build a strong foundation in clinical documentation and patient care. Working as a medical scribe allows me to observe medical decision-making firsthand, which will help me as I pursue a future career in healthcare or medical research. Tip: connect this role to your larger career aspirations to show commitment. Question 15. Why should we hire you as our medical scribe? Here's how you can answer. You should hire me because I bring strong listening skills, attention to detail, and a genuine interest in healthcare. I type quickly and accurately, stay calm under pressure, and always prioritize confidentiality and professionalism. I'm confident I can support your physicians efficiently and contribute to smooth clinical operations. Tip: end confidently by summarizing your strengths, accuracy, focus, and professionalism. Final thoughts. A medical scribe interview evaluates your ability to balance accuracy, speed, and professionalism in a demanding clinical environment. Employers seek candidates who can think on their feet, document meticulously, and maintain confidentiality. Preparation should include reviewing common medical terms, familiarizing yourself with EHR systems, and practicing attentive listening. During your interview, speak clearly, stay positive, and show enthusiasm for learning. Emphasize your dedication to supporting doctors and improving patient care. When you combine focus, responsibility, and genuine passion for healthcare, you'll stand out as a dependable medical scribe ready to excel in this vital supporting role.